Thank you. The gentleman yields back, and the chair now recognizes the chair of the full committee, Chair McMorris Rodgers.
Good morning. Whether or not you know it, almost everyone in the room relies on animal drugs approved by the FDA. Whether you have a pet, drink milk, eat meat, the FDA plays a very important role in making sure the drugs we give animals work and are safe. This is especially important to make sure food is safe for humans to eat. The Center for Veterinary Medicine at FDA is responsible for regulating animal drugs and is funded in part by congressional appropriations and in part by user fees paid by industry. If we don't reauthorize this legislation on time, FDA can no longer collect fees, and the drugs that farmers and pet owners rely on may not come to market. It's important that we get this done on time and work in a bipartisan way to keep any controversial policies from slowing this down. We're off to a good start. I'm glad that industry and FDA submitted recommendations for this reauthorization ahead of the January 15th deadline. And today we will be considering legislation that reauthorizes the animal drug user fee amendments and the animal generic drug user fee amendments. The agreements before us reflect nearly 2 years of negotiations between FDA and industry. We appreciate the hard work from those involved in those discussions. This will be the 5th ADUFA reauthorization and the 4th reauthorization of AGDUFA. And in the 20 years since these authorities were established, we've seen significant improvements to review times for new animal drug applications and continued progress towards getting safe and cost-effective products to the market faster. Over the course of the negotiation process, we've heard from industry and stakeholders on current challenges within the animal health market, including rising costs of pet care and limited options available for treatment. We're also hearing how the significant growth in new drug application fees are limiting participation in the animal drug user fee programs. This ultimately leaves us with fewer and less affordable options to treat our country's animals. It is clear that we need more innovative and affordable medicines on the market, and I look forward to discussing FDA's plans to better utilize existing processes to expedite the review and approval of animal drugs. The agreements contain several proposals that address supply chain issues, funding for pre-approval foreign inspection capabilities, and commitments to exploring additional EU and US good manufacturing agreements. FDA will also commit to a third-party evaluation of CVM's utilization of review processes for animal drug applications. Independent assessments such as these are critical, as this committee conducts oversight over the agency's mission and fulfilling its regulatory and public health responsibilities. We look forward to reviewing the findings from this assessment. The proposed agreement for the animal generic drug user fee program should help get more lower-cost animal drugs to farmers and pet owners. FDA is committed to providing increased engagement with generic drug sponsors through new meeting processes. These meetings will provide additional opportunity for sponsors to engage with the agency's scientific staff to better understand what data is needed to support new animal drug applications. I'm also looking forward to discussing CVM's plans to transition staff and resources back to in-person operations as we continue the corner on 3 years since the beginning of the pandemic and as the COVID-19 public health emergency is set to end on May 11th. In addition to the user fee agreements, we're also considering legislation introduced by Representative Nancy Mace, the Generic Animal Drug Availability Act. This bill would improve pathways for generic animal drugs seeking approval for single species and as combination products. I look forward to today's discussion. I believe there's a bipartisan commitment to reauthorizing these agreements on time. Thank you.
Thank you. The chair yields back. The chair reminds members